Whitetulip Health Foundation is a 501c3 nonprofit organization that connects healthcare professionals who want to reach their highest professional potential and give back to society. Its aim is to create a platform where healthcare professionals can share ideas and experiences, collaborate, and provide mutual support to each other, and channel their own personal passions and skills into community projects both locally and abroad. Our foundation took its name from the white tulip flower, which is an important symbol of purity, caring, and aspiration. As white tulip grows, we continue to be inspired by this perennial sun seeker and seek to share our passion for healthcare. While in the beginning, we were just a few inspired medical doctors striving to do some good, now, with more than 500 volunteer healthcare providers in more than 30 states, White Tulip is proud to serve our communities with mentorship programs for healthcare professionals and outreach activities for the public. Despite this rapid growth, we are determined to preserve our core values in the years to come. As the healthcare industry encounters many issues in today's world, such as rising costs, an aging population, a shortage of healthcare professionals, and healthcare disparities, we believe White Tulip is filling an important gap to face these challenges. Let us briefly go over our two main missions, which are mentorship programs for healthcare professionals and outreach programs for the public. White Tulip provides free of charge, one-on-one, as well as group mentorship to medical students and doctors. For this purpose, we have 14 different mentorship programs to help them reach their maximum potential at every stage of their professional career, including Student Zone for high schoolers considering healthcare for the future, U.S. Pre-Medical Student Mentorship Department, U.S. Medical Student Mentorship Department, International Medical Student Mentoring, International Medical Doctor Mentoring, Post-Medical Graduate Mentoring for international medical graduates residing in the U.S. and in the process of integrating the U.S. medical system, WHF Center of ESL for medical professionals, Center of USMLE, Residency Application Mentoring, Intern Resident Mentoring, Faculty Academic Development, Specialty Groups, Alternative Path Mentoring, Career Center. Alongside the physicians, other medical professional groups including dentists, pharmacists, nurses, and psychologists have their own mentorship programs and serving our communities. To take a crucial step in their professional development and academic life, WHF is providing financial support to its member medical professionals, particularly recent international medical graduates, as we believe they are underserved populations, to assist them in adapting to the health system in the U.S. These programs not only allow them to spend their valuable time taking the necessary steps to integrate into the U.S. healthcare system, practice their profession, and become self-sufficient contributing members of society, but also help them to close the healthcare provider shortage, particularly physician and nurse shortages in the U.S. White Tulip is proud to provide almost 90% of all donations as direct scholarships to healthcare professionals and has already provided over $2 million in scholarships to nearly 200 medical professionals over the past 5 years. Most of these scholarship recipients entered further training programs, either residency or fellowship, to continue their medical careers, and some become faculty at the leading medical institutions including Harvard, Yale, Stanford, and Emory universities over the U.S. White Tulip Public Education Department encourages the involvement of healthcare professionals in public health education activities to tackle critical healthcare education issues, raise awareness, and ultimately promote healthier lives. Our bilingual healthcare providers have been providing health education to underserved and vulnerable populations, such as the elderly, women, and recent immigrants. When the COVID-19 pandemic hit our country, White Tulip volunteers worked hard and managed to conduct a significant number of COVID-19 webinars and seminars in communities with language barriers, working with community leaders to educate and implement preventive measures. We established a COVID-19 support phone line where our volunteers answered questions from the community and prepared educational sessions and webinars to support the mental well-being of our community. Whitetulip has been working to introduce underserved communities to low-cost and free healthcare opportunities available locally where they live and has created free and low-cost healthcare guides for many states. Whitetulip has opened in-person free clinics in New Jersey and Maryland, accepting low-income patients without insurance for medical examinations by licensed physicians. We are hoping this experience will encourage our other volunteers in many other states to open free clinics. Whitetulip volunteers are collaborating with the Red Cross to organize blood drives in many states. Whitetulip also helps people in need globally and holds mobile clinics at regular intervals in orphanages in Haiti and in the underserved areas of Malindi, Kenya, and has performed hundreds of treatments, vaccinations, and educational activities.
I thought it was a really fulfilling trip. I really wish I could have stayed longer. I don't feel like all the things that we need to do are done.
When a devastating earthquake struck Turkey and Syria, Whitetulip launched a fundraising campaign. Our volunteers found and distributed aid to hundreds of families in need in the first few weeks and continue to help thousands who suffered psychologically. Whitetulip is in partnership with many Ivy League universities and is accepting volunteers and summer interns for ongoing health projects and outreach programs. So far, it has provided more than 200 high school and college students with internship opportunities. We are honored to receive the 2021 Platinum Seal of Transparency about programs, budgets, and financial statements from GuideStar, which puts Whitetulip on the top 1% of nonprofit organizations listed. Whitetulip's headquarters are now in a new location on U.S. Route 46, Fairfield, New Jersey, and will continue to bring healthcare professionals together and serve the community. At our foundation, we are constantly striving to make a significant difference in the lives of those we serve. Over the next few years, we hope to expand our efforts further to address healthcare disparities in underserved communities with particular focus on recent immigrants. Whitetulip has come a long way and made tremendous progress in a very short time. None of these wonderful achievements would have been possible without the support of our dedicated volunteers. However, we realize that there is still much to do. We thank you for all your help and support on behalf of all the people who Whitetulip has touched and made a significant impact on. Together, we care better.